in the Berkheim skin substitute market by leveraging the valuable jellyfish biomass with nanotechnology for medical and bio applications. Basically, more than 160 million patients suffer from chronic and acute wounds, creating over $21 billion market. So this is basically a global epidemic. Chronic and acute wounds reduces the quality of life, produce significant economic and medical burden. And there is no clear Okay. So there is no clear solution, and doctors often combine up to 4 different products in order to manage healing, infection, and moisture, which is resulting in a high cost, prolonged recovery, and increased complications. Our solution is integrating all essential healing factors into one-stop shop solution. Medusa Cure developed unique and revolutionary smart wound dressing using collagen and mucin derived from jellyfish, which is a sustainable and renewable source. In this way, we get accelerated wound healing, superior fluid absorption, and antibacterial absorption, all with non-mammalian renewable raw materials. Our pipeline is vast. We can start with a wound dressing up to personalized skin, and I will give you some example right now. Can we start the movie? If you look at the movie on the right side, you see that we can use a portable device of electrospinning. You can see that we basically can create a really thin layer of dressing on top of the skin. So now think about that, can we start this one as well? So think about that you can cover the whole area of the wound and the burn, and look what happened after about 1 minute. Basically we formed a new skin with nanomaterial, very, very thin, with all essential factors in order to heal the wound much, much better, with no scar tissue, and you can see exactly what's going on. There is no adhesion. So basically you can replace the dressing whenever you want and without hurting the patient and form a new scar tissue. Okay, so I showed you in a few seconds ago what is the layer that is formed. So basically, if we want to design our own dressing, we can basically make as many as layers that we want in order to cover the area and give the best solution. So if we want to do it in a factory, we can create different layers. All of them are nano-sized matter. As you can see, we can have a collagen followed by silver nanoparticles that give you an antibacterial protection, and a hydrogen layer that absorbs the X-rays and release humidity. This is a combination of quantities that reduces healing period at much lower cost and burden, and actually can bring you for recovery in about half of the time of either treatment. The result is full recovery. We have in preclinical trials in porcine excellent results that are better than any leading commercial competitor. We got full recovery with no necrosis, no inflammation, no bacterial contamination, and most importantly, no crust formation or basically any scar tissue. So as I mentioned, our R&D pipeline is vast, and we can do wound dressing, but we can also do personalized skin. The idea with personalized skin is that we can actually create, in a very severe burn casualty, a long-term personalized wound dressing. What we are doing is we are using a 3D skin autograft that we can create from our polymer and seed on the top of it cells that we are taking from the patient. So basically, think about it. We can take a scalp size skin from the patient, put it on top of our scaffold, and let it grow in the lab for about 3 to 4 weeks. After 3 to 4 weeks, we get a layer of the patient's own skin. And then if he has a burn or really tough wound, we can basically put his own skin on the wound and get really full recovery. Our team is actually most of the pronounced members in the world. Professor Shachar Richter actually is the head of the Department of Material Science and Engineering at Tel Aviv University. He developed the nanotechnology. We are working with Professor Joseph Hayek, which is the head of plastic surgery and National Burn Care Center at Shiva Hospital. Thank you again, and I will be more than happy to give you more information after the talk. Thanks a lot.